On today's Two on Your Side Town Hall, what's next for Catholic Health? We're going to talk exclusively with the head of the health system about getting things back to normal after that strike has ended at Mercy Hospital.
Plus, boosters for everyone. Pfizer's trying to get that approval from the FDA again. We'll ask a local doctor what's changed this time.
And reason for concern. We're going to hear a local labor expert about why Starbucks employees here in Western New York have a chance at unionizing with voting starting today.
We're glad you're with us. And first up on this Wednesday, with the strike ending at Mercy Hospital, today union members were officially back on the job.
Hundreds returning to work inside the hospital for the first time in more than a month. And we got some pictures to show you here of a couple of different groups of workers in Mercy's labor and delivery department.
This strike didn't just impact the employees in the hospital, but all of Western New York. And we've heard from the union several times over the past few days on what happens next.
And now we're joined live by Mark Sullivan, President and CEO of Catholic Health. Mark, we really appreciate you coming back on. We just talked hours before the strike started, more than a month ago. Now here we are hours after it has officially ended. We're glad to be able to talk to you again. You know, nurses and other hospital workers back on the job at South Buffalo Mercy. Let's start here and maybe look at what was happening at the hospital today. And then the question that we're getting the most from our viewers, when do operations return to normal? What's that timeline going to look like?
Great. Well, great to be with you, Michael and Kate. And it was a great day today. Yes, the skies were sunny, but most importantly, they were brighter over Mercy Hospital. We welcome the soul of Mercy Hospital back. We have an outstanding leadership team there that greeted them early this morning to a round of applause, and we were back to work. We're excited because we lead the region in quality, and there'll be a step process that we need to go through to make sure that we acclimate the associates back to the work environment, that we're sensitive to the staffing proposals and what we have in our contract. So we're going to be back to what I call the new normal in the near future, but we're being sensitive to both parts of the organization as we come together.
Yeah, we talked with union leadership and frontline healthcare workers after the vote to end the strike, and we asked about easing the animosity between the two sides. Listen to this.
There will be tension and there will be a lot of bad blood, but we're going to walk in that door with our heads held high. We are stronger today than we were 2 months ago because we walked these sidewalks together as a group, and we grew closer and stronger, and we bonded as a family.
I want everybody to know that I got a very nice text message from Mark Sullivan this morning congratulating us on the work that we did. They want it to be a new day at Catholic Health. They want to reestablish a trusting work relationship with CWA and work with us to implement our new contract. So I don't think we can ask for anything more than that.
So you go through this battle for more than a month to get this contract hammered out. From your perspective, how do you now go about repairing that relationship after what's been a pretty contentious situation?
Yeah, I think it's important to note that we were not just negotiating, we were building something special for the patients in the community of Western New York. So my leadership team and many associates, over 400 physicians and associates, have been through training actually in the last month to focus on how do we become an organization that can welcome people back. We need to be focusing forward. We need to be focusing on patient care. We need to celebrate the win for the community. There wasn't one side that won and another side that won. The patients won, the community won, and hopefully the state will follow behind us and see this blueprint for success that both CWA and Catholic Health spent a lot of time storming and forming. Now we need to perform. So we're looking forward. We have great associates, great leadership team. We lead the region in quality, and the only way to look is forward.
Yeah, we saw some pictures of some of the nurses returning to work today, Mark. They were wearing masks, as they should be, but it looked like they were smiling under those masks. I know that they were really glad to be back on the job. We know, though, that staffing was one of the big sticking points during the negotiations, both sides coming to an agreement on that. I imagine now comes the difficult part. You know, we're in the middle of a nationwide shortage for healthcare workers, especially nurses. So how do you overcome that and get the people hired to fill whatever gaps may exist?
Right, Michael, great question. There's two parts. There's a short-term solution and a long-term solution. We believe the short-term solution is to get the word out. We have the most comprehensive progressing staffing model in the region, in the state, and maybe even in the country. We have fair and competitive wages. We have high quality. We're on the leading worldwide electronic health record, Epic. So we have an environment that is conducive to people that want to grow their career in nursing, EVS, environmental service workers, service and technical workers. So we have to get that message out. And we've already heard from people that left that want to come back. We've heard from people that are now interested in learning more about this great blueprint we built. That's the short-term solution. The long-term solution is we have a blueprint. Now we turn to the elected officials to sit down, take their pens, and write legislation that will build the workforce of the future. We have an antiquated reimbursement system. We have an antiquated recruitment system in this state and in this nation. The infrastructure bill that President Biden is talking about now, healthcare workers are the infrastructure and the backbone of our community. We need to make those same investments and then also look to the payers to help support this infrastructure. So long-term, how do we raise the organization up? It's really important. How do we raise the community up? It's looking at policy changes and really welcoming people into this great state of New York and to Western New York to work in healthcare. No matter what health system it is, we all need the workers here, and it's a great day.
And especially now as we're still dealing with a pandemic. And while we have you here, we wanted to ask you about COVID tonight as well, because the numbers have been trending upward for new cases and hospitalizations. We're going to show our audience a graph here, and our region now has 269 patients in the hospital with COVID, and we haven't seen numbers that high since late April. At the same time, we lag behind the state as a whole when it comes to vaccinations. So how do you assess where we are right now in fighting the pandemic?
I think there's a couple points. We led the vaccine, Western New York Vaccine Hub, and we had a big push for vaccinations early on. We need more people to get vaccinated. Number one, that must occur. And also with the younger children as well, that needs to happen. Number two, we need to be thinking of social distancing. We believe that we're vaccinated and everything is good. We still need to practice social distancing, which I think is important. Then my own speculation, again, my speculation as a non-clinician, is we just had an election. We had a lot of people in close quarters. We have our bills parties. We have people gathering. We have people getting together, and we have greater access to testing. So the best thing you could do is protect your family, get vaccinated, mask up, keep social distancing, and really focus on healing our community. And we need to get those vaccination rates up, as Governor Hochul has mentioned time and time again.
And Mark, we're almost out of time, but just to follow up on that, do you anticipate that, your health system and the other hospitals in Western New York may have to make any changes in the short term if we continue to see the hospitalization number going up? I mean, I know we all hope it's going to, level off and start to go down again as we've seen all these cycles, but right now it is headed in the wrong direction.
Yeah, we paid that tuition in March of 2020, Michael. So this is the new normal. I think that we understand the data better. We are doing a better job managing patients that have a high acuity with COVID. We have sensitivity analysis we all use throughout the nation. Supply procurement's different. So we're monitoring it. I think we are better educated, better prepared, but we want to see that number go down too. Remember, the workers we spoke at the bottom of the hour here are the workers that have been through the pandemic. They're our heroes. They're exhausted. We owe it to them to get vaccinated, to become well, and let our community move forward. And that's what we're committed to do. So we'll be ready and nimble like we have been since the pandemic started. And at Catholic Health, we promise to deliver the community the high quality that we set out to do over 170 years ago.
And we will leave it there for now. Mark Sullivan is the president and CEO of Catholic Health. Mark, thanks again for your time tonight.
Great. Thanks for letting me be with you.
We're going to stick with COVID now. Pfizer asking the FDA to approve booster shots for all American adults. This news kind of got overshadowed yesterday and had some of our viewers asking, is that a good idea, and is it likely to happen? Yeah, remember, Pfizer made that same request just a few months back. Has anything changed from then until now? Because back then, regulators only approved Pfizer boosters with emergency use authorization for specific groups of people, those over 65 and then people 18 to 65 who are at higher risk of COVID because of their job or their medical condition. The FDA and the CDC said at the time that experts needed to take a little longer to review the data to see if boosters would help the general population. Pfizer says its research now clearly shows that protection from the first 2 doses is dropping and a booster shot will help. So today we asked UB's Chief of Infectious Diseases, Dr. Thomas Russo, what can we expect going forward?
I think it's likely to be approved. I think the original concern was what will be the value of a younger, healthy person receiving a booster shot, even if they had a breakthrough infection or would likely be asymptomatic or mild disease. However, we know all bets are off if you get infected and develop COVID. There's always the risk of long COVID and uncertain long-term consequences. Plus, even if you're young and healthy, although the benefits of optimal protection may not benefit you ideally, it will benefit those that you interact with in your household and your social circle, and particularly those individuals that are more vulnerable. And so booster shots will be a benefit not only for individuals, but for our community at large.
And so the FDA will consider this request possibly within the next few weeks, maybe before Thanksgiving, well ahead of the Christmas travel season and all those gatherings.
Yeah, about 25 million Americans have gotten boosters so far, and it's estimated that with an approval, it would open it up to 30 to 40% of adults who aren't eligible right now.
Dr. Russo also adds more important than boosters is just making sure that the unvaccinated get the first dose or those first 2 doses, depending on the vaccine.